Has Premier Kenney learned from his pandemic mistakes? Does he think more private healthcare options should be offered now to help a beleaguered healthcare system? Let's find out. Joining me now is Alberta Premier Jason Kenney. Premier, good to have you back on the program.
Good to be back, Evan.
Look, there's lots of concern about if this has peaked or not. In your province, hospitalizations due to COVID-19 surpassed 1,000 for the first time since mid-October. There's makeshift beds for some of the people. You got about, 5,500 Alberta health staff out sick every day. Surgeries are delayed. Boy, it looks tough. Why have you said the peak is past? Maybe things are still very serious to come.
Yeah, well, it is a serious situation, but I believe we have passed the peak of transmission. Our positivity rate seems to be coming down sharply, and our wastewater data shows declines in COVID in 15 of 19 communities where we track it. And as you know, Omicron around the world has typically been a 4-week wave, so I think we're starting to come down, but we'll be going up in hospitalizations with the lag effect that we all know about for the next probably week or two. And thankfully, because of the lower severity of this variant, it's putting relatively less pressure on the intensive care, which has really been our sensitivity in Alberta. So, there's going to be some difficult days ahead still for our healthcare workforce, but it is, I think we're going to be able to manage to get through this.
Okay. You didn't put in the same kind of restrictions that some of the other provinces like Ontario and Quebec did. Are you worried that you are going to downplay the seriousness of COVID as you did in that best summer ever, which you've apologized for, and that was optimism trumping science? Are you worried about that again?
Well, no. By the way, Evan, we took it